Hey, this is Greg from Big Bay Mornings on 99.7 Now, and I'm here with board-certified plastic surgeon, Dr. Bae. Good to see you again, Dr. Bae.
Hey, Greg.
How's it going?
Going well, going well. I just want to point out that that is an awesome man cave with that UT
Thank
colors.
you. Look at that,
It's
and look at my Longhorn thing back there. Yeah,
and are you familiar with the actual name of the color, that type of orange?
burnt orange. How could I not be? I went to the
Actually, burnt
University of
sienna.
Texas.
Yeah, it's
That's
burnt
not what
sienna
we
technically.
say at UT. Here, I even have this for you, Dr. Bay. Look at that. Hook 'em. I know you went to not really a rival school, but close, close to
No,
University of Texas. You went to LSU.
oh no, no. For medical school, but I actually went to UT Austin for undergrad. We were a few years off though.
Yeah.
You're getting confused, but it's all right. Age does that to
Listen,
people.
don't try to say I'm the older one here. But anyway, all right. I've got a question. Speaking of UT, since we both went there, I have this handy dandy mask. See my UT mask? I've got it
Looks
all.
like a looks like a jock strap, but okay.
I've got those too, but I won't go get it for you. I got the mask for you. I'm not going to get the jock strap for you. But
And don't get them mixed up. And don't get them mixed up putting the jock strap on your face.
I don't know. In my world, that could be kind of exciting. But anyway, we better get back on track before we get in trouble here. Speaking of these masks, though, we might not have to wear them forever. We are turning a corner here with the
Mhm.
pandemic. Now, of course, we want people to keep wearing their masks right now. But
Mhm.
one of the things that I kind of like about wearing the mask is it covers some of the things I don't like about my face and the waddle and maybe any imperfections. But that's your specialty to fix these kinds of things.
Yeah, I mean, it looks like things are getting a little bit closer back to normal. I mean, the CDC said this week that if you're vaccinated and you can be inside with other people that are vaccinated, and you can even be with other people that are unvaccinated as long as they're not high risk. So the time of starting to remove masks is happening now. I mean, it is according to the CDC. I know each state has different rules, but it's happening. People are starting to take off masks, and then you're going to be able to start to see maybe the thin
Uh-oh.
lips, the jowling,
I'm
the
going to
full
see the
neck, the turkey gobbler neck.
COVID-19, the COVID-19 that
Exactly.
everybody gained.
Right. So if anybody starts to get a little uncomfortable with that, people are still able to work from home, so you can go get treatments and still recover from home. So that's still pretty convenient. But yeah, when it comes to the lower face that was covered by a mask, yes, you can get lip fillers if you want. If you want to plump those up, you can. If you have jowling, maybe just slight jowling, you can actually do liposuction along the whole neck, along the jawline. That can help with jowling. If you have really bad jowling, then you need more of a facelift, but that's obviously a bigger step for some people. And then when it comes to the neck, lots of different things you can do, surgical and non-surgical. As far as the neck goes, if you have a little bit of fullness here, there's something called Kybella that will melt the fat, but keep in mind it will make your neck swell up like a bullfrog for about a week afterwards. Um, then,
Then you'll
uh,
need
then
the
the
mask again.
That's true. You'll need the mask again. The other option is cool sculpting, which is just freezes the fat and then the fat dies. That the nice thing about cool sculpting is that it doesn't cause that big bullfrog swelling for the week after the treatment. So that's good. And then if you really want to take it a step further, if you have a little bit of misplaced skin here, then you can do a surgical treatment like I offer that I developed and I got published for. It's called the semi neck lift, single incision, minimally invasive neck lift, where we just make one incision here and we undermine the skin, tighten up the skin here, and it avoids those big incisions behind the ears where you would normally remove excess skin. But for the patients who really do
Yeah.
have that big turkey gobbler neck, have skin that they got to get rid of, then yeah, you would need to do a full neck lift for that, where you make those incisions behind the ears and remove the skin. So
Well,
lots of options out there.
and I have personal experience with this because my friend Anna, she flew from Dallas. She came all the way from Texas to get her semi neck lift with you, Dr. Bay, and she
Thank you.
absolutely is overjoyed with it. She loves the results.
Well, thank you very much for the referral, Greg. You'll get a little discount the next time you come in. Not that you are getting anything.
I'm coming. I'm coming. You see this? I'm coming. Get your needle ready. Get that Botox ready for me.
It's ready. You've got a bottle of Botox with your name on it.
Thank you, Dr. Bay. That's good. All right.